All right, so part one of our pharmacology. Sorry, I'm grabbing my charger, my computer here. I'm very prepared this evening. Sorry about that. It's been a long Monday. All right, let's try this again. Okay, so at least you're plugged in now and it won't die in the middle of my video. So, renal system, okay? The renal system is chapter 11 in your Pharmacology for Technicians textbook, and we are going to be covering the renal system. So this pharmacology only has 2 chapters associated with it. It is the renal system, and then the endocrine, which is chapter 14. So first part of the renal system is the function of the renal system. So the function of the kidneys. So your kidneys are designed to maintain the balance of water, electrolytes, acid and bases within the extracellular fluid. Your kidneys form urine, which enables your blood to reabsorb the necessary nutrients and water and electrolytes needed, and then it allows your body to get rid of the toxins through your urine that are no longer needed or that your body is not going to reabsorb. The regulation functions of your kidneys, so it regulates plasma volume. It regulates the concentration of waste in your blood. It regulates the plasma electrolyte concentration, and then it does regulate the acid-base balance of your plasma. So on slide 6, you actually see a picture of the body system. You see that we do have a right and left kidney. Your kidneys, we can live with just one kidney. So a lot of people have one kidney. They're born with one kidney stops working. Sometimes both kidneys stop working and you're donated a kidney. A lot of family members will donate a kidney to another family member. So you know, it's not like your pancreas or your heart. You know, you can't live without it or part of it working. You can live with one kidney. So each kidney, you have a left and right. Each kidney will have a renal artery coming in and a renal vein going out. So that is the exchange of blood. So your artery is bringing oxygenated blood to your kidneys. Your veins are taking the deoxygenated blood back to your heart for reoxygenation. Each kidney has ureters, which will send the urine down into the bladder. Within the bladder, it holds and concentrates your urine until you expel it out when you use the restroom. So again, your renal artery brings blood into the kidneys. Your renal vein returns the blood to the bloodstream. Your renal cortex and the medulla is actually what performs the filtration. So inside your kidney, it is made up of nephrons, and these nephrons are the functioning filtering units of the kidney. So each kidney has about 2 million nephrons each that you are born with. That's all you get, and they are the filtration process of the kidney. So the filtration of the kidney is the removal of substances from blood. So it will remove out toxins. So during this filtration process, you can have reabsorption, which is the pulling of substances back into the blood. So let's say you're not very hydrated, so it will pull that water back into your blood. That's why you don't urinate very much when you're dehydrated. And then secretion, which is releasing the substances into the urine. So let's say you've had too much alcohol or you've had too much of some sort of substance. Your body does not need that anymore. It's going to secrete it into the urine and become waste, and that's how your body gets rid of it. So acute renal failure is a rapid reduction of kidney failure or function, resulting in an accumulation of nitrogen and other wastes within the body. There's many different causes. You can have renal ischemia, sorts of trauma, sometimes pregnancy, volume depletion, any types of hemorrhage, cancers, surgery or shock. Uremia is a clinical syndrome resulting from a renal dysfunction. So it's a increase of uric acid in your blood. Symptoms include nausea and vomiting, vertigo, convulsions, and in severe cases, coma. Your ureters are paired muscular ducts, excuse me, that move the urine from the kidneys into the bladder. So your bladder collects and holds the urine until it exits your body during urination. Your bladders can actually hold up to 1 liter of solution. This was kind of my favorite thing to do, to hold up an IV bag, a 1 liter IV bag, to really give you an idea of how much 1 liter is. But we're at home and I don't have one. So if you want to look up something, or maybe look for your something in your refrigerator or something that is 1 liter, sometimes some water bottles, containers like that are 1 liter, just kind of put that into perspective of how much your bladder can actually hold. But really at the 300 to 400 ml amount is where you start to have that urge to urinate. So we typically, unless we're having to hold it for some sort of reason, we can hold up to 1 liter, but around that 300, 400 ml, that's when you start to get the sensation that you have to use the restroom. So as your bladder fills with fluid, your bladder starts to descend, and as that distension of your bladder happens, you start to have the stretch receptors will sense the pressure, okay? And then it will speak to your detrusor muscles, which will begin to contract. It'll allow your external urinary sphincter to relax. You then push your urine out and you empty out your bladder. It's not good, obviously, to hold your urine. The more full that your urine can become, the longer you hold it, the more fluid that accumulates in there. It'll get pretty hard to hold. Eventually your body is just going to say, nope, I can't hold anymore, and it's going to start to come out. Maybe not in a full flood, but you're going to have some leaking. So micturition is the process of emptying your bladder. So urinary retention. So your kidneys produce urine, but the micturition process does not happen properly. So that's where you get urinary retention. So your kidneys are working fine. It's producing the urine. Your bladder's filling up, but there is something along the lines there that is not allowing you to empty out your bladder. That's urinary retention. A lot of times, especially in males, it's caused from BPH, which is benign prostatic hyperplasia, and that's because the prostate is swelling and increasing in size, which is pushing up against the ureter, which doesn't allow the urine to flow from the bladder out. Incontinence is the opposite. It's the inability to control your external urinary sphincter, which means you now have urine leaking out of your bladder. So that happens as we age. Our muscles start to not be as firm and elastic, I guess, elastic as they used to be. A lot of times women who have had a lot of vaginal childbirths can really kind of stretch out that area, and so they suffer from urinary incontinence. So retention is the kidneys are working fine, the bladder's filling up, but you're not able to get rid of the contents of the bladder. Incontinence is you're having a hard time keeping the contents of the bladder inside because we have the ability to make sure that sphincter stays intact and closed until we sit down or stand to use the restroom. So assessing your kidney function, this will be the last slide, so slide 13 that you're going to review. certain things are looked at in your blood level. So they will do a blood urea nitrogen known as BUN, and a serum creatinine. So these are good indicators for good kidney function. So they're looking at your body's ability to eliminate the extra uric acid and nitrogen within your body. It's looking at the blood concentrations within your kidney function. So within your blood your blood urea nitrogen level, your BUN and the serum creatinine, these are a good indicator on how well your kidneys are functioning. The problem with kidney disease is usually in the first couple stages is there's no signs or symptoms. So having regular blood work done yearly in a physical is really important because they're looking at these type of things, and because the early stages of kidney disease are very quiet and usually symptomless. This is something that can be an indicator that something's kind of going on with your kidneys. Sometimes you have kidney stones and they haven't been passed yet, or they haven't been to a part where you're starting to physically feel the pain of those stones, but it is inhibiting your kidneys' ability to function properly. So there's a lot of different contributing factors. So slide 13, this is all we're going to get through. For now, we're going to take our time through these. We only have 2 chapters to cover in the next 3 weeks, so we're going to take our time. If you have any questions, please don't hesitate to reach out. You have my phone number, you have my email address, you know what my office hours are, so please go ahead and reach out. Otherwise, have a good day.